Hi there.
Hello.
My name's Amanda. I'm going to be your nurse today.
Hi, I'm Maria.
Hi, Maria. It's nice to meet you.
It's nice to meet you too.
So how are you doing today?
I'm okay.
You're okay? So you were diagnosed with HIV 1 week ago.
Mm-hmm.
Can you tell me what you know about HIV?
I have HIV now, and that means I'm going to get AIDS.
Okay.
So that means I'm going to die really soon.
Okay. Is that what your doctor told you last week?
I don't remember. He just talked really, really fast, and I wasn't really
Okay.
paying attention.
HIV is a virus that we found in your blood, and it attaches to your cells and particularly hurts your immune system. So that's what is used to fight off infections in your body.
Oh.
And those T cells, that's what we call them, are what are in danger. So we like to tell our patients that HIV is no longer a death sentence as it once used to be. And most people nowadays can live with HIV and never develop AIDS.
Really?
So you can live a long, healthy life, and we just have to have you adhere to a certain medication. So it's called antiretrovirus therapy. So that's a medication you'll have to take every day, but with it, you'll be able to live a long and healthy life.
Really?
Yes.
So is this a medication I have to start now, or do I have to have more tests done?
So you have to start this medication as soon as possible. So today we'll let you leave with a prescription, and it'll help you live a longer life.
So I don't have to get AIDS and die?
No, you don't.
Wow, that's great.
Yeah.
Thanks, Nurse Amanda.
You're welcome. So with the Retrovir medication, how it works in your body is that it's going to attack the HIV, the virus in your body, and hopefully decrease the amount of it that's in your body. It will never be at zero, but by decreasing the amount of the virus and attacking it with this medication, hopefully we will improve your immune function and not let it get any worse. So it'll keep you where you are at your baseline, so you can function just as you have been for the past 28 years of your life.
Wow. So this means I won't get any worse and it can't progress to AIDS?
That's the ideal of this therapy. So over the course of your life, we may add medications, but this is the main therapy. It's called the antiretroviral therapy. So it's antiviral. So we want to kick out that HIV as much as we can and get it to the lowest level in your body, which is why we're having you do blood tests and liver function tests so we can monitor how the therapy is working.
That makes so much sense. Thanks for explaining it.
Of course. So we want to go over a couple education things with you as far as your diagnosis and medication goes. So I know you mentioned that you were married. Mm-hmm. Were you thinking about having children anytime soon?
I definitely want to have children.
Okay, so when you have HIV, you can become pregnant, and you will not pass the HIV onto the baby during your pregnancy. The only risk for transmission, so the baby getting the HIV, is when you give birth, either through C-section or a vaginal birth, either one. There's a risk of transmitting it, and then breastfeeding is also a way that you can transmit the virus to the baby. So if that time comes and you become pregnant, it's definitely a good thing to keep close contact with your OB and all of your providers so you can discuss the best way to keep a healthy pregnancy for you and baby. And along with pregnancy, it's important to practice safe sex practice. So I know you are married, but condoms are a great idea so they can help prevent pass the HIV onto your husband. And also, if you are going to be sexually active, it might be a good idea for him to start a similar antiviral therapy just to reduce the risk of transmission as much as possible.
Okay. Mm-hmm. So you're saying that I can get pregnant still and that I won't hurt the baby while I'm pregnant?
Correct.
Only with the delivery and breastfeeding?
Yes.
And that to practice safe sex practices will help to prevent my husband from getting HIV as well?
Yes, very good.
Okay.
Another thing we want to do is what we want to prevent opportunistic infections. So that means any infections in your close environment that could happen. So you want to wash your food really well. You want to make sure you're always washing your hands. Try maybe not to touch your face so much. And we just want to keep you as healthy as possible.
Okay, that makes sense.
Okay, do you have any questions for me?
I don't think so, but thank you so much for taking the time to go over everything.
Of course.
It made me feel a lot better.
Yeah, so you have your pamphlet and your handout and all the phone numbers if you need anything from us, okay?
Great. So hi Maria, I just wanted to talk to you about that medication that we were discussing before.
Okay.
So do you know anything about the medication treatment?
It's called retro something, and I take it every day for the rest of my life, I think.
Exactly. So it's called Retrovir, and it's also called Zidovudine. I wrote a couple things on the board, that way we know.
Okay.
It's used to treat your HIV, and it's a pill that you'll take every day.
Okay.
It's not something to be alarmed about or scared of, but I just wanted to go over the side effects with you, so that way you were aware. But like every medication, there's always side effects, so don't be alarmed that this medication does have side effects.
Okay.
A couple common ones are nausea and vomiting. Along with the nausea and vomiting, it's also common sometimes to feel weak.
Okay.
One of the side effects that's very common is called a black box warning.
Okay.
And what that means is just a lot of times with medications, those are big warnings that you want to be aware of and the doctor to make sure that they watch and monitor for.
Okay.
It's called myopathy, and it's just muscle weakness.
Okay.
So I know sometimes it's common to feel tired or a little bit lethargic. But with this, it's common for you to have that muscle weakness.
Okay.
So if you do feel this, just be mindful of it and be patient with your body if you want to sit and relax for a while or lay down. So those are the major side effects with it. But because you are taking this medication every day, it's important that you stay on the regimen of taking the medication every day, just because if you don't, it can build up a tolerance in your body so that after you stop taking it, it's hard for your body to use it.
Okay.
Do you understand what
So
that
then
means?
I could get more of the virus if I stop taking it and then start again?
Not necessarily more of the virus, but your body will get a little bit resistant to the medication, so it won't do as good of a job protecting your immune system.
Okay.
Yeah.
Okay.
Another thing that's important for you to do is to make sure that you get regular blood checks. So you go and get your blood work checked every 3 to 6 months for that CD4 count, which has to do with your immune system.
Okay.
And then every 6 to 12 months for your liver function. And that's because this medication is metabolized or broken down in your liver. So we want to make sure that it's working and that it's not doing anything detrimental to the health of your liver.
Okay.
Does that make sense to you?
That makes sense.
Okay.
Can you guys help me set up those appointments?
Of course, we're happy to make you set up the appointments. We'll also get reminders, and we do suggest that with both your medications and with your appointments, that maybe you set up an appointment reminder in your phone, or you let your husband know so that he's another source of support for you, that you could make sure you have it.
Okay.
We also have this pamphlet for you if you want to take it home with you.
Okay.
It has all the information that we've given you today so that you're able to have it as a resource. Our phone numbers are on there, so if you need to get in touch with us, feel free to call at any time.
All right. Thank you so much.
You're welcome. And I know this is a scary diagnosis, but we're here for you in every way.
Okay.
And anything you need, just let us know.
All right. Thank you so much.
You're welcome.
Hi, everyone. Thanks for watching our little sketch. So for our patient education strategies and tactics, one of the big ones we used was ask what the patient already knows.
Yeah.
Because HIV has a big stigma behind it, so we wanted to ask Maria what she already knew, and she said what we kind of feared, which is that HIV equals AIDS and death. So we got to correct that misinformation as well.
And I think it really helped for the patient to feel more comfortable, knowing that just because she was diagnosed didn't necessarily mean that a million other bad things were going to happen as well. So just having her listen and then make sure what she heard was the correct information was a great way to have her understand. We also did teach back, which helped her to comprehend what we were saying and then repeat it back to us so that she knew the correct way and the correct information. I think that also helped her to feel more comfortable.
Yep. And then finally, we gave her other resources. So we gave her our phone numbers, we gave her a way to set up her appointments, and just other resources that she might need from other professionals to deal with her diagnosis.
Yeah.
So thanks for watching.
Thank you.